PGH Ministry, I would like to welcome you to this very relevant talk entitled What to Do When COVID Hits Home, Solutions to the Current Surge. Given that the virus is hitting harder than we thought, for some of us, closer to home as well, it is very useful and wise in this time to learn more about what we are battling. Today, do not fall prey to any misleading information circulating on social media. Rather, we gain first-hand knowledge from one of our own frontliners, an expert on infectious diseases. I would like to wish all of you a very fruitful session this afternoon. Thank you for being with us, and may we all be spared from the plight of this pandemic.
Good morning, everyone, and we'd like to welcome you to part 2 of our PGH Q&A. This is a follow-up to our MiniStream episode entitled When COVID Hits Home. We are so blessed and honored to have with us again one of the nation's leading experts on infectious diseases. She has been a frontliner since the beginning of this pandemic and has served as a spokesperson for the Department of Health in combating this pandemic. Ladies and gentlemen, let us all welcome once more Dr. Anna Ong-Lim. Thank you, Doctora, for being with us.
Thank you, Poppy, for having me back.
Thank you also. We would like to focus more now, Doctora, as you know, on the home remedies. There are a couple of questions that have been left unanswered, and we would like you to dispel some theories that certain people may have in administering home remedies. One of the questions that we received, Doctora, is this: how can we disinfect the room of a positive patient when it is time for them to come home? Do we hire a professional cleaner, or can we do it ourselves? Is there any particular protocol that they need to follow for this?
So the way the question structured is, the assumption is that person is outside of the home and needs to come back, no?
Yes.
And probably use the same area that was assigned to him or her prior to the time he left.
Mm-hmm.
So the role of objects in the environment in transmission of COVID is quite minimal. As we all know, the major route of transmission is by droplets, and it requires for these droplets to be able to enter the person of enter the person who will be infected immediately after the transmission. So whatever finds its way to surfaces or objects, for as long as it dries up, then it's no longer able to survive and no longer able to transmit. So there are actually recommendations coming from US CDC that says if you have an area where a cluster of cases occurred, if you don't use it for a week or so, you don't even need to clean it any differently from the usual way you clean the environment. So assuming that this person may have been outside of the home for 5-7 days, recuperating in the hospital, then you don't need any special cleaning for the area that they will go back to. I would say maybe you have to change the linens, of course, no, but the surfaces should be cleaned the way you would do it regularly.
All right. Is there any particular routine? Well, just a couple of follow-ups to that same question. Is there any particular routine that people who go out on a regular basis to that they should follow to ensure that they don't bring home the virus accidentally?
So there are people who do a lot of mga ceremonias when they go home.
Yes, yes.
Oo. I don't know if I should say this, but I mean, considering I go to the hospital, I don't really. So maybe I'm the extreme, no, yung kabila namang end.
Yeah.
But again, going back to the concept that this is really more of a droplet transmission.
Yes.
Then whatever makes its way to your clothing, the other surfaces, your stuff, isn't really very significant.
Yeah.
However, having said that, there's nothing wrong naman with exercising general hygiene. So when you get home, no, if you have the chance already to change out of your street clothing, it won't hurt.
All right. So that's part of the protocols. Well, this is also another follow-up in line with that question. Of course, practicing
Oh,
all
well,
these
sorry, Poppy, ha. Let me just add to that. Kasi
Sure,
the
Doc.
point lang naman kasi is, how will it get to the areas which predispose to infection?
Yeah.
So it's your eyes, your nose, your mouth, di ba? And what comes into contact with that are your hands.
That's
So
right.
yun yung importante talaga.
It's really the hand washing.
Oo. Unless you make it a habit to, parang rub your other body parts on your face, and it's very awkward, di ba? It's
Yeah,
a natural behavior. So, it's quite unlikely that you will transmit anything significant from other surfaces.
Yeah. Would alcohol, Doctor, be as sufficient as hand washing? Or let's say, for example, hand sanitizer? Because there are many people who, who are super OC with their protocols, and there's actually been a long-standing debate about it. Na is alcohol relatively the same as hand washing, or possibly even safer? Especially because there are some people who, when they go out, they bring their alcohol spray with them also.
Um, they should be as effective as each other. The difference lang kasi is if you have visibly soiled hands or surfaces,
Yeah.
you don't just want to use alcohol or sanitizer because it just tends to spread the dirt around. It doesn't wash it off. So if it's visibly soiled, you really do have to use soap and water.
Alright.
Pero pagka, let's say, clean naman yung surface, pwede kang mag-alcohol, lalo na kung hindi available yung soap and water conveniently.
Okay. Well, supposing that after practicing all these protocols, because we both naman know, Doctor, there's no guarantee that after practicing all these safety protocols that we would be spared from the plight of COVID. What medicine can we give for those who have tested positive or those who are showing symptoms? Is there anything in particular that we should do in order to boost our immunity system, suppose we have tested positive or we're exhibiting any symptoms?
So let's divide that into the two categories. If you don't have any symptoms, then there's really nothing much that you can do except to wait for the 10-day period over which you will be assumed to be no longer contagious. No studies have actually proven that any supplement or any drug taken at that time when you're asymptomatic will fast track your recovery or prevent progression to symptoms. So unfortunately, there's really nothing much you can do except to wait it out. Now, as to supplements, again, there's nothing that's proven. So what I usually advise people is that whatever they were taking prior to illness, particularly if they were prescribed because you have certain health conditions that make it difficult for your body to absorb certain nutrients, you continue those. No? Kasi those conditions are still there even as you're dealing with your COVID illness. Now, for those who have symptoms and they fall into the mild category, remember the criteria that we stated, no?
Yes.
Then you will probably be at home, and at home you will probably feel either body aches and pains or fever or maybe cough and cold symptoms. And the medications for those are the ones that we've used for other similar conditions. You can take paracetamol for fever. Even for body aches and pains, paracetamol can help, no?
Okay.
And then if you have cough and colds, then your typical medications for these symptoms will continue to work. Now, the question there is, if you take vitamin C or zinc or
Yeah.
vitamin E, will that help? Because now you have symptoms.
Yes.
So there's a reference. It's called the Philippine Society of Microbiology and Infectious Disease, or PSMID, Living Guidelines. It's available on the web, and there are sections there that say that deal with these supplements. No? And again, the bottom line is there's no proof that it works.
Yeah.
For the adult population that they reviewed the research for.
That's right. Well, yeah. Now that actually makes sense, because there are some people who who are concerned whether or not their meds will work when they start exhibiting symptoms. And of course now there are many people who are, who are taking extreme risks by, stocking up on medical supplies. And one such supply that is running out is oxygen tanks. But there is such a thing, Doctor. I don't know if you've heard of it. It's called an oxygen concentrator.
Concentrator.
What is your take on having that at home on standby in the event that you test positive or you exhibit symptoms also?
So once again, no, it's very critical to introduce the concept of patient selection.
Yeah.
Kasi not everybody is going to be suitable for home care.
Mhm.
You need to make sure that the patient falls within the mild category, or if ever this patient is moderate, meaning the symptoms are a little bit more pronounced, but still no difficulty of breathing, still no decrease in the oxygen levels, and no risk factors, so less than 60, no comorbidities. And they're the kind of patient who will be able to ride out the symptoms without the need for an oxygen tank or an oxygen concentrator. Ang oxygen concentrator, the concept there is it is able to take in pure oxygen from the air, process it in the machine so that what is provided to the patient is the concentration that will raise the level of oxygen in the body. So it's actually an oxygen tank, except that you don't need to refill it because its source is coming from room air.
Yeah.
Now, because room air oxygen concentration is only 21%, then of course there's a limit to what any machine can concentrate out of room air.
Yeah.
So that's something to keep in mind, no? So it sounds very attractive, but you don't have to keep on refilling it. But what it's able to provide will probably be not so. It won't be able to provide too much oxygen, and definitely not enough for somebody who's really sick.
Yeah.
So the use will be limited. Now, so do you need to stock it? Do you need to keep one on hand? Do you need to have a tank on hand?
Yeah.
I think what something like that will do, whether the concentrator or the tank, what it should do or what it will do is to buy you extra time. It's not going to be something that you will continue to use in your home setting. Kasi kung kailangan mo na ng oxygen, doesn't that mean that you need to be in a facility
already?
Oo,
Yeah,
oo.
that's true.
Dapat talaga, unless siguro we're talking about somebody who's been in home care for some time already.
Yeah.
And their setup is already
Fixed.
such that they can manage, no,
Yes.
even these illnesses. They already have supervision, then that should be fine. Pero yung coming from COVID, tapos mag-attempt kang mag-home care with oxygen on hand, medyo very challenging.
That's kumbaga it's not advisable to
No.
that, really.
I wouldn't attempt it.
Kasi parang ngayon nga there's a fad na parang everybody's been stocking up, they've been hoarding like crazy about that. Maybe because they're fearful that one of COVID's leading symptoms is difficulty breathing.
Right.
So,
Pero alam mo, Poppy, yun nga. So I think the mindset should be, I'm not setting myself up so that there's going to be someone in my home who needs oxygen for maybe 10 days throughout the duration of illness. Hindi siguro. Pero I'd like to have a tank available so that when I'm setting my patient up to be transported, hindi ako natataranta kasi nakikita ko bagsak ng bagsak yung O2 saturation niya, na wala man lang akong oxygen tank habang nagtatawag ako ng hospital or ng ambulance service. So, ganun lang. So, siguro kung meron isa, tapos dapat marunong kang gumamit, hindi lang tank yun, na meron siyang regulator, meron kang cannula or face mask. Kasi you need to know how to set that up.
Yeah. And ano pa naman, Doktora, oxygen tanks are also known to be one of the more sterile materials that you have on hand.
Well, yeah, oo. No, it has to be medical grade oxygen. Hindi siya yung kung ano-ano oxygen tank lang, di ba?
Yeah,
so,
that's
may
also
din yan,
another
specifications.
May specifications then. Okay. It's really no, it's not as simple pala as it
Oh
sounds.
no,
You
it's not.
can you
It's
can
not.
just get an oxygen tank and then hook it up.
Just leave it there at the side, no? Parang
Yeah.
fire extinguisher. Hindi,
Yeah.
ganun.
Talagang may ano pala siya.
You need to know how to use it.
That's interesting to know. I learned something new today. Here's one question that came in for us, Doctor. How come when somebody tests positive for COVID, after as you explained even in the first Q&A session, people who test positive need to go into isolation for a certain period of time. How come after that elapsed period of time, they still test positive? What's normally the situation? Why does that happen?
It's really the parameters of the test. No?
Mm.
The test is intended to pick up the genetic material of the virus. And it does its job so well that even if you have tiny, tiny amounts of that genetic material, it can still pick it up.
Mhm.
Now, picking it up doesn't necessarily mean that you're picking up the whole viable virus.
Yeah.
So the question there is, how do you know, as you continue to test positive, that you're actually picking up viable or non-viable virus?
Mm-mm.
So studies have been conducted already, doing the testing in a serial manner,
Yeah.
not just with PCR, but going one step further to what is called the viral culture. So it's kind of like gardening. They try to grow out whatever it is that they pick up from the specimen. And what's been observed is that beyond day 10, for patients who are mild, they're no longer able to grow out whatever they're picking up as a positive test in the RT-PCR.
Okay.
So the current thinking is that beyond day 10 for mild cases, plus 3 more days without symptoms to be sigurista, you're no longer contagious.
You're no longer contagious. But is it possible? This is a follow-up. Is it possible for mild and asymptomatic cases to suddenly progress to severe cases while you are in isolation?
Well, not suddenly, but you can.
Gradually.
That's why we want for such cases to be under the care still of a healthcare professional, even if they continue to be at home.
Yeah.
So the setup should be the home is the setting for the provision of home-based care, which is basically supportive, but is still under the supervision of a healthcare professional, whom the caregivers will be contacting on a fairly regular basis to report the progress of the patient, so that if there are any observations that will warrant more testing or perhaps a face-to-face visit, then that can be set up even before the crisis comes.
Yeah.
Kasi you don't want to be in a situation where you're in an emergency, you're scrambling to transport, trying to find a room or accommodation for your patient in a health facility. That's really not a good situation to be in. So you want to be monitored so that these early signs that healthcare professionals know how to pick up will be seen.
All right. That's why, but yeah, okay, now that makes sense. Okay, we're going to go a little bit in depth into the vaccines because a lot of these questions are really vaccine related. But at least for home remedies, we've somehow tackled a lot of ground. So I guess, Doctora, this leads us to probably our last 5 questions. Would that be all right with you?
Sure.
All right. After the first jab, are you partially protected already? If yes, what is the percentage rate?
The answer is yes. No, there will be some kind of partial protection.
Yeah.
It varies depending on the vaccine. And it varies according to the time points at which you're making the observations.
Yeah.
But the uniform observation is that this protection doesn't last very long and needs to be boosted by a second dose.
Yeah.
So particularly for those vaccines that are designed as a 2-dose series. So that's why we still prescribe that both doses should be completed to be able to take advantage of the full protection that that particular vaccine will offer.
This applies to all vaccines that are multi-shots, like
Correct.
Sinovac, like Astra.
Astra.
I think as of now, it's only Johnson and Johnson that have single shot vaccines, if I
Yes,
remember
but
correctly.
you know, if you look at their trials, they're also looking at a two-dose version of this, no? So parang yung one dose is kind of like, maybe I would call it a contingency, no, in the context of scarcity of supplies, and you want to
Yes.
cover a large proportion of the population. The single dose is being offered as an option.
At what phase is J&J in their clinical trials? Are they at the third phase already?
Most of these that have EUAs,
Yeah.
no, you only get an EUA if you're at least if you are in phase 3.
Okay. What are the intricacies? This is a question that came in. What are the intricacies of a phase 3 testing? What normally goes on there, and how do they deem it as effective for people?
So for vaccine trials, no, you go through 3 phases.
Mhm.
Phase 1 is safety, deals with patients in the dozens, konti lang,
Yeah.
less than 50 usually yan.
Mhm.
And then your phase 2 looks at efficacy,
Mhm.
and then you deal with hundreds of patients.
Yeah.
And then when you get favorable results for your phase 1 and your phase 2, then you proceed to phase 3, which typically enrolls about tens of thousands of patients.
Yeah.
Now, depending on the trial, they will have what they will call endpoints or
Okay.
outcomes that they want to observe.
All right.
This will vary depending on the quality of vaccine.
Yeah.
But what is common to all of these COVID vaccines, of course, is endpoints like prevention of death,
Mhm.
or protection against severe to critical disease.
Yeah.
No? And for some, they will also include protection against mild disease.
Mhm.
But the validity of the results of these studies are dependent on how the statistical analysis are done. And of course, we know that for statistical analysis to be valid, you need many, many, many samples. Kaya umaabot ng tens of thousands yung participants sa mga trials na ganito.
Yes.
And if you can also imagine, it will take time to observe these outcomes, diba?
Yeah.
You need to find out that for every single person who has been vaccinated, for example, versus the other half who have not been vaccinated, you want to observe whether they were actually infected, exposed muna, then actually infected, and what happened to them. So that's the problem. Observations of that category, of course, cannot be done in an instant. It takes time. And typically, these phase 3 trials will take anywhere from 1 to 3 years, depending on the outcomes that they want to observe.
Mhm.
So the problem is, because the pandemic is ongoing and continues to affect so many people, we cannot afford to wait for these 1, 2, or 3 years to pass before we start using the vaccine.
Yeah.
Especially since data has shown us, based on very limited observations,
Mhm.
that not only are the vaccines safe, but they're also effective.
Yeah.
So the mechanism to be able to get people or allow people to use these vaccines even without the phase 3, which is a requirement for licensing, is to give the regulatory authorities, the different FDAs of different countries, the authority to issue an emergency use authorization, which they issue to governments, because governments are supposed to take the responsibility of monitoring and regulating if in case there's a need to suddenly pull out the drug or stop its use temporarily or regulate where it's going to be used, which is precisely what's happening now to the Philippines in the context of AZ, diba?
Yes.
So, parang people get very anxious about, why is it stopped or why are we not using it now? But for me, I think it's really incredible that the system is working.
Yeah.
Diba? Na parang kinaya ng local regulatory natin na to keep abreast with what's happening abroad, which is part of its job naman talaga, no?
Yeah.
And that our system is in place to say, wait lang, I think it's safer for us to make a decision to stop this for the meantime, wait for the data, review it first, then before we give a go signal.
That's right.
Which is what we're doing now.
Because of the reports on blood clotting with regards to Astra, correct?
Exactly.
That's actually another question that that came in. If there are still AstraZeneca available, can seniors still avail of this vaccine?
Okay. So, well,
As
in
of
the
now,
first place
given
pala
that,
eh.
yeah, given that the
Oo,
data
no?
is, inconclusive as of now due to the
Right,
blood clotting reports.
right.
What's your recommendation on
So,
that?
um, the observations actually affected younger populations, primarily women. So there were no issues
Yeah.
with individuals in the elderly population.
Yes.
Tapos, the observations also showed that if you did not react to dose one, there were no problems attributed to a dose two.
Correct.
So I think those are very key findings kasi it allows us to identify the populations at risk if the um, discontinuation were to be maintained, no? So those will be very important considerations. Now, currently, no Astra available, so it's a moot question. I think this becomes something that needs to have a decision once the new stocks of AZ come in.
But what about those who have already received their first jab of AZ? What will happen to them?
So, we're actually at a good place again, Poppy, no? Sa, iniisip ko nga parati, ang galing lang talaga ni God. Eh.
Yeah.
Kasi, di ba, dapat mas maaga dumating to, tapos urong-sulong, di dumadating.
That's right, Doc. That's right.
Tapos, finally dumating.
Yeah, we've gone through a lot of struggles with that.
Right, right. And then we heard about these issues with the blood clotting about a month after we started rolling out.
That's right.
Halos ubos yung first dose. And it wasn't due for the second dose yet. We're not yet due for second dose until June. So we have time.
Also, it's not
12 weeks. It's a 12-week interval between doses.
It's a 12-week interval.
Right.
I think that's what that was the answer everybody was looking for, Doc. Kasi parang, with all these different vaccines, they all have different time periods in between the first and the second dose. Like Sinovac, if I recall right, is I think 27 days.
It's 28, so 4 weeks.
28 so far. In the case of Astra, now we know for sure that it's a 12-week interval in between the first and the second dose.
Actually, it's a range, Poppy, pero the best results are coming out favoring the 12-week interval. So that's what the local recommendation says, no? So for those people who receive dose 1, they're expected to start receiving dose 2 from June onwards. So una, wala pang stock, paparating pa lang. We were told by WHO that it would be coming in April. So okay, that's fine. We don't need it yet.
Yes.
We can wait until June to give the second doses.
Which is actually the expected timetable for the arrival of the second batch of vaccines, if I understand right, no, Doc?
Well, it should come in before that, no?
Okay.
And also, by then, we expect to have more information about whether there's a continuing issue with these blood clots or finally it's been put to rest. Kasi right now, the wording from the European Medicines Authority is plausible association. They're not saying, I am sure that this is related. It's plausible association. So, it's hedging a bit. Since sabi nila, pwede. So, kung pwede, sino yung apektado? Piliin natin.
That's right. There's another question, Doc, that came in. I think this was semi-asked and answered the last time na parang we were able to address who can receive the vaccines. In this case, a question came in. If let's say they tested COVID positive and they exhibited symptoms and they recovered, how much time should they wait before they receive the vaccines?
The answer there is they can be vaccinated as once they're fully recovered.
Once they're fully recovered.
So the only exception there will be if they receive convalescent plasma.
All right.
They might be asked to wait a little bit. No? Pero in general, once they're fully recovered, they will be allowed to be vaccinated. The reason for this is we don't really expect the previous illness or the vaccine to adversely affect each other.
Yeah.
So you won't react any differently to the vaccine because you went through the illness already prior. No? And the reason why we want to wait until you're fully recovered is really just so that there's less confusing if you develop some symptoms after you're vaccinated. Kasi if you develop symptoms and you're still just recovering from illness, now it becomes a question of whether are you worsening because of your underlying illness or is it because of the vaccine? That's a point of confusion. Whereas if you had already fully recovered, you're okay na, wala ka ng symptoms, and then you get vaccinated, you develop something, then you say, oh, well, it's likely to be from the vaccine. And you manage that accordingly.
Yeah. Well, what about those who have already been vaccinated? I mean, me personally, I know of a mother of a 4-year-old who recently got jabbed with Sinovac, if I recall right. And what she did, she's one of those people who, as I explained earlier, who's crazy about their hygiene and their protocols when they step out. She was explaining to a group of us na she had to isolate herself from her family just as a safety measure. What's your take on that? Na for those who have young children, do they need to isolate themselves? Is that necessary for their protection? Because we both know naman, Doc, that 4-year-olds aren't really permitted yet to receive the COVID vaccine. What should be the case for households like that?
So I guess in general, the question is if you're vaccinated, do you have to isolate yourself after the vaccination?
Yes.
Whether it's because you have kids or elderly in the household or you just want to be careful.
Yeah.
So let's remember that the vaccine is inactivated. It's not alive.
Okay.
So there's no way, even if it got into your body, that it will resurrect and cause an infection in yourself and cause you to transmit the infection to others. So that should not be the reason for isolation.
Correct.
And actually, it's not isolation, it's quarantine. Diba? Kasi you're exposed but you're not yet infected.
Mm-hmm.
Now, are you quarantining because suddenly you spent some time in an outdoor venue with other people and you may have been exposed? Baka yun din yung thinking, di ba? Kasi I went to a public place, there's so many people, there might have been somebody there sick.
Given pa naman that the vaccine venues, they don't really, there are some that aren't as organized, but they're also
quite crowded. No? So that the question to answer there is, was your exposure a high risk or a low risk exposure?
Mm-hmm.
If it's low risk, defined as you were always wearing your mask and shield, you
always spraying everything you touch with the alcohol or Lysol.
Well, actually, the critical points are physical distancing, air circulation, and your time of interaction. Yung time siguro medyo mahirap mo makontrol, di ba? Kasi mag-aantay ka doon ng matagal.
That's right.
Pero yung karugtong kasi nung 4 dapat, 3 sapat. So if you can get 75% of that correctly, the risk categorization is still low, and therefore it should not be any different from the risk that you have for running your errands on a daily basis or maybe going to work, no? So quarantining yourself because of the exposure to the vaccination venue, if you were able to implement your apat dapat consistently, also doesn't seem to be warranted.
Yeah.
The other thing you have to remember is, sige, kung gusto mo lang talaga, you just want to be very, very sure.
Yeah.
That quarantine is 14 days. You don't just decide, okay, today, then tomorrow, I'm done, ha?
Yeah.
Kung hindi mo lang din siya gagawin ng tama, parang wala ring point, di ba?
Tama naman. There's actually, with regards to quarantine, there's a question that came in. How do you isolate when you live in a small house without rooms together for other family members?
Yeah, that's difficult, no?
Yeah.
The WHO document that I referenced in the talk actually recognizes that setting to be a possibility. And they say that if there are no single rooms available, then you have to space yourself 1 meter apart
Okay.
in common areas, and then you have to always be in a mask.
Yeah.
preferably also a shield kung kaya, pero you know
Yeah.
how challenging that is, diba?
Yes. Which is actually
Basically,
recommended in households as of now, diba?
well, actually, yung ano nga, di ba? Parang there's a recent DOH pronouncement that if you're in the home setting and you can possibly wear your mask, you
Yun
should.
nga eh. Yeah.
Oo. So, mahirap no?
Yun nga. That's why we had to ask for, for certainty also kasi ang dami ring na OOC about protocols.
Well,
like
if
that.
you can, no, of course, that's always
It's recommended.
good. Oo.
Yeah.
Pero the question there is, can you manage to stop it from entering your home?
Yeah.
Because basically, you want your home setting to be a protected bubble.
Yeah.
So how do you do that? Everybody who goes out needs to be careful about implementing their measures so that they're not infected, so that when they come home, they're not exposing their other family members.
Correct.
Now, one thing that I think people need to remember is that when they're in their workplaces, one of the things we like to do is to eat together. Diba? It's a very Pinoy thing.
Yes.
And it's really very ingrained in us culturally. So
Yeah.
talagang bawal kumain ng may kasamang iba, please lang. Kasi yung mga workplace clusters na na-identify na ganoon, if you ask them, kumain ba kayo ng sabay-sabay, tapos magtitinginan na yung mga tao. Kasi,
Hindi pa nila sinasabi.
Well, kasi hindi naman siguro intentional na ayaw nilang ipaalam. Di ba parang dun lang nag-hit yung realization na, shucks, pwede nga pala yun, ano?
Yes.
Hindi nila naisip.
Yes.
So I think people need to be aware that when do you take your mask off ba? When you eat. So you don't eat together.
Which is actually one of the known transmitters now, diba?
Yeah.
That's the thing, Doc. Parang in many scenarios like that, somebody taught me that parang you should always presume yourself to be asymptomatic in order for you to practice the protocols properly.
Presume yourself to be asymptomatic, or you assume the person that you're talking to is infected.
Is infected.
Well, both ways, no?
Both ways.
Infected, asymptomatic, yes.
Well, here's one question that came in. If you are asymptomatic positive, how long can you be a carrier of the virus?
Carrier kasi parang implies that the person continues to be positive for a fairly long period of time and is spreading the disease without being affected.
Yeah.
And therefore they're asymptomatic, no?
Yeah.
Typically, that term carrier state is used for more long-standing infections like typhoid or hepatitis.
Yes, correct.
In the context kasi of COVID, alam natin na yung infectivity stops by day 10.
Yeah.
So, hindi natin usually ginagamit in the usual sense yung term na carrier.
Yeah.
So, pero the answer there is about 10 days. You remain contagious for 10 days, even if you're asymptomatic.
Yeah. Okay. Okay. I think we're down to our last two questions, Doc. This is correlated to the kids inquiry kanina. Diba we were saying na parang it applies to having both kids and elderlies in the house. In this case, how do you this is I think mainly for the kids. How do parents ensure their protection? Because we both know naman that kids aren't really permitted to get vaccinated. But there have been reports that with the new strains of the coronavirus coming about, a lot of kids have also been infected lately. How do they ensure that their kids will be protected? Is it sufficient to boost their immunities with vitamins and supplements? Or is there anything else in particular that they should be practicing?
Okay. So maybe let me address first that question of whether kids are particularly prone to be infected given the presence of the new variants.
Yes.
The answer is that there's no conclusive proof to say that this virus or these variants seeks out kids more than the original
strain of the virus.
strains. Oo,
Yes.
yes, no. It's just that because the absolute numbers are growing, then you expect the proportion of each um, group
Yes.
to also increase.
Yeah.
So like if we have 10,000 people and the typical representation of individuals below 18 is about 8%.
Yeah.
That's still larger in absolute number compared to if you're talking about a daily rate of 1,000 and still 8%. Yun yung problem. So dahil dumadami yung kaso overall, mas madami din yung representation ng bawat age group.
Yes.
Now, therefore, since you expect more kids as a number to be infected as well,
Yeah.
then how do you protect them? We don't allow them to go out. No, their movements are very limited, so it becomes a responsibility of the adult household members to continue to be vigilant and not bring the infection home.
Yeah.
Kasi doon naman sila mahahawa eh.
Correct.
Tapos, can you prevent it? Well, in the same way as we said, there's no evidence for any medication or supplementation to prevent or treat COVID in adults. There's also the same data applies for children. However, if I may qualify that, our Food and Nutrition Research Institute actually has data looking at the population level, looking at zinc, vitamin C, and vitamin D. Levels across different segments of the population in children. And parang in general, our children are less adequately nourished compared to, well, I guess from developed country settings, no? And so it seems that in general, they will benefit from supplementation.
Yeah.
So I guess what you can do, as parents, is to coordinate with your pediatrician and find out whether, based on their assessment of your child, whether kailangan niya ng supplementation to promote general health muna, and then to continue that if in case nagkaroon ng COVID yung bata.
Yeah. Tama naman. At least, well, I think it still should boil down to protocol pa rin. Tsaka, yeah.
Yes, oo. Tsaka, yun nga, yung nababanggit ko kanina, in general, yung supplementation doesn't seem to have evidence. Pero yung problem kasi natin sa Pilipinas, maraming batang hindi adequately nourished, no?
Yes.
So, I'm sure that also has to do with socio-demographic factors. So, kaya sinasabi ko lang na maybe for those families naman who are able to provide good nutrition, kailangan i-assess muna ng doctor nila kung eto bang batang to magka-qualify for need for supplementation.
Yeah.
At saka the other thing is, even if it's not an economic issue, yung bata picky, talagang hindi mo mapakain ng whatever.
Yeah, that's another thing.
Din yun. Siyempre, meron siyang mga deficiencies na kailangan mo rin namang i-supplement.
Yes, the kids pa naman are known to be picky eaters also.
Yes,
but we can't discount that even in a pandemic. That's still human nature.
Right.
Doc, with regards to vaccines, is it advisable to take a booster shot after? Is there any time period that should elapse before you do, if it is recommended?
Right now, we don't have the information for that. Also, Pino. As I was saying kanina, parang we have very limited data. So right now, the vaccine efficacies that are being quoted are really just to protect against moderate severe critical disease, but we don't know whether their efficacy extends to long-term protection and whether to achieve that we need booster shots. That needs to be observed.
Yeah. Naman. I think, Doc, in the last talk, you were also able to mention that getting shot with 2 different vaccines is not really advisable, if I recall, right? So even after, let's say, for example, after beyond the certain time intervals, it's still not prescribed. Like, let's say, for example, Sinovac has a certain number of days where you can get the second dose. If, let's say, for example, one is injected with Sinovac and he or she decides to wait, let's say, 6 months and then decides to get Moderna, it's still not advised to do so.
Walang data on that. So,
Walang data.
I'm sure over time magkakaroon tayo ng more information kasi even for the other vaccines, ganun naman yung nangyari.
Yeah.
Minsan nagkakaroon ng shortage of one brand, tapos binibigyan ng another brand from the same platform, tinitignan yung impact. No? Pero ngayon kasi, all we have is 2-dose studies for the same brand. So that's the only thing we can recommend.
Yeah, that's the only thing we can afford.
Yeah.
All right. Well, that's really something to ponder on. Okay, this question just came in. We will entertain this as our last question, and then we will ask you, Doc, to give us your final words and your most recommended advice for home remedies, most especially for the people who possibly have been asymptomatic carriers without knowing. I mean, this is the case for a lot of people who have been practicing their protocols. This is still with regards to vaccine, and this is in light of the recent article that came out that the European Union will be carefully monitoring people who have been jabbed with a Sinovac vaccine. What do you call this? Asa na ba yun? Sorry, I got lost. After completing the 2 doses of Sinovac, can they take another vaccine? This is apart from the 2 shots of Sinovac, which we were discussing earlier. Can they take another shot or 2 of a different brand? Is there such thing as an overdose on the vaccines?
For the vaccines that already have been in the market for decades, no?
Yeah.
And in circumstances where people might not recall whether they completed their doses or not, our recommendation to them is just go ahead and complete another series kasi there's no such thing as an overdose.
All right.
Problem lang with COVID is that our experience is so short that we don't want to deviate from what has been in the studies so that we can continue to assure safety of whoever receives the vaccines. So with that as a basis right now, the recommendation is just to complete the 2 doses of the vaccine that you started off with in the time frame that is recommended. And with respect to switching or receiving a second or third series, we don't have any information on that, but definitely you can be sure that this will be closely watched because this has been the pattern also for other vaccines that continue to be in use, and there will be circumstances where that will be necessary, and we hope that the database will be sufficient for us to make good recommendations to assure that this will be safe and efficacious.
Yeah. And there are a lot of uncertainty. So I guess this is the reason why everybody's been asking doctors like you to debunk all these theories and with medical facts, which is exactly what we're doing now.
So medyo limited nga lang yung information, no? I hope people don't get very impatient about it kasi this is really very early days and we just want to be extra careful.
Yeah, considering pa naman na tama naman. At least. Okay, so I think we've reached the end of our Q&A. Doc, any final words of advice for those of us who step out and who practice their protocols to maximize avoiding infection of the virus and being asymptomatic carriers inadvertently?
So thanks, Poppy, for having me again and giving me a chance to answer the remaining questions.
Yes.
I hope this has been helpful. I'm sure there are always more and more. It's really a very rapidly evolving topic, and there's always something new to learn. Hopefully, there will be another chance to get these questions together, and if in case there's enough to discuss, and maybe we can do this again.
That's right.
But as a reminder, for the audience, what we really want to do is to stop COVID from entering our home.
Yes.
Because we don't even want it to hit home.
Yeah.
Diba? Parang hearing the stories of people who have had to experience this, you don't want to be in a situation like that.
Yeah.
So the goal is actually to prevent those people who need to stay out of the home or need to be out of the home from being infected in the first place. So, Poppy, what you mentioned about treating every person you meet
Yes.
as being an infected
Asymptomatic.
person, or
Yes.
even if they're asymptomatic, is a
Yeah.
good mindset to have.
Yeah.
And if you think about it in that perspective, then you will be consistent in the implementation of your protective protocols.
Yes.
Apat dapat is very easy to remember. Di naman difficult din gawin, no? And in
Yeah.
most cases, kaya natin i-control each of the elements.
Yeah.
Now, once, or rather, if it happens na nalusutan ka pa rin, no? Nangyari pa rin yung iniiwasan mo.
Which we can't naman avoid from
Well,
happening.
yes, oo. Kasi nga, hindi hindi naman 100%
Yes.
no, protective yan. The goal naman is to minimize the interval over which you might be spreading the disease within your household in an uncontrolled manner. So that means at the onset of symptoms, isolate, then test.
Yeah.
I won't even say test, then isolate, di ba? You
Yes.
isolate first, then you
First,
figure
and
out
then you
how you're
test.
going to be tested.
Yeah.
Tapos, yung household mo, habang inaantay yung test mo, should quarantine already.
Yeah.
And kung awa ng Diyos, it's negative, then everybody's home free.
Yeah.
Now, kung nag-positive, you can take comfort in that you did not spread the disease further because you kept yourself away from others and your household did not contribute to community transmission because they already quarantined.
Yeah.
The thing there is medyo mahaba yung intervals. All in all, that will be about 14 days for you and your entire household. Putting in all the parameters together, di ba? All of these restrictions. So more or less 14 days. And then you have to set up the protocol so that you can continue to isolate and quarantine, not infect others, but receive care in an appropriate manner.
Correct. Well, with that, Doctora, on behalf of the PGH ministry, my fellow ministry members, and of course my co-chair, Katrina Pacheco, thank you so much for coming on board to answer the remaining questions. We really hope that, not just for our parish, but for the different communities who have, who have tuned in even from the first session, this will be a help to them, and hopefully there will be more fruitful sessions like this to come in the near future, because, there's no better way to battle this pandemic than through scientific facts and medical knowledge, which we are blessed to have been able to learn from you. So really, Doctora, this has been a great help to us, to our ministry, to our community, to the parish, and most of all to the Philippine nation. Thank you for being a blessing to us, and thank you for taking this time again to dispel all these different theories that one might have and may conceive to be true, which in some cases don't turn out to be that way. So
thank you. Thanks
you so
everyone,
much,
and I look
Doctora.
forward to welcoming you back to PGH when things improve.
Yes, we hope so too. We hope so also. We also hope for the same thing. So, ladies and gentlemen, that was Doctora Anna Ong-Lim. Thank you for tuning in, and of course, Doctora, thank you for giving your time to be with us. Right?
The PGH Hospital Ministry started 30 years ago, led by the late Steve Lopez and Inday Canoy, now over 90 years old. The mandate was to supply medicine to pediatric patients in wards 9 non-infectious and ward 11 infectious ward, who were the poorest of the poor but with good prognosis. The ministry took care of patients from referral to discharge. Patients discharged were even visited to see how they are progressing. The ministry had a budget of 2 million per year, servicing over 150 to 200 patients. Members would visit every Thursday and personally distribute medicines to bedside of patients. There were short conversations to learn about disease of patient and spread encouragement and give hope. Over the years, the service expanded to Hema Onco and NICU and SNK, which is School for Chronically Ill Children. Aside from distributing meds, we also have activities such as our home visits wherein we check on our patients on how they are doing. Visita Iglesia and Pasyalan wherein we bring the outpatients to the zoo, museum so they may enjoy a different scene apart from the hospital.
One of the more interactive events our ministry bridges between the parish and our beneficiary is the Christmas gift giving. It is a seasonal event in which our team would invite any and all other ministry members to join us in one morning of fun with the kids from wards 9 and 11. We would open that morning with the anointing of the sick, rites care of Father Rayo and the pastoral team, followed by a program of games and contests before we conclude with the gift-giving proper. Of course in Santa Claus fashion, minus the costume, but with one goal in mind: to put a smile on everybody, and we mean everybody's faces. Not just the kids, but the adults as well, ministry members and volunteers alike. So come, join us, experience this unique kind of happiness with us, where it is very much present and contagious. Join us in Team PGH.
Wave Beats Music.